We're going to move on to the problem list tab now. Now this is a historical view and as well as current view of a patient's problems and or diagnosis, as you could tell here. And it is recommended that this problem list be updated as provider sees a patient. But you'll notice that some of our problem lists tend to be longer, especially with these test patients as well. Just the main thing I wanted to point out here is it'll give you as a nurse an overview of what kind of problems this patient has had or even currently have. Okay, you could highlight on the active section here, and it'll just show the active problem list. You'll notice too that at one point a patient may have had a flu 10 years ago. Probably not important right now, but it'll be here as well. It'll be inactivated or possibly removed as well. Okay. From the nurse's perspective, I don't see nurses filling out the problem list all that much. I think it's more of gives you an overview of what the patient has gone through in the past. So I think just for the sake of the recording, I'll talk about how to actually enter a problem list. It's pretty straightforward here. You'll notice the new problem button here. You could go ahead and click on that, and you'll notice that there are diagnoses based on systems and based on the top 10, top 20, if you will. You can highlight that. You could look at the list real quick and see the main diagnoses that the patients have had. You could also click on other problem and look based on the diagnoses. Okay, in this case, I'm going to just put in diabetes. I just pick that usually. Okay, and there will be other ICD-10 based diagnoses for this. Okay, and I'm just going to pick the first one that comes in, and I'll put that in there. Okay. It looks similar to a highlighted problem. I'm just going to proceed for the sake of this test, just to show what exactly are the different prompts here. Okay, you'll notice that most of these items are already pre-filled. The service-connected items are already pre-filled as well. You could add a comment if you'd like. I'm just going to click OK on this one. Okay. Now you could also look at the different sections for inactive, both inactive and active, as well as the removed. Okay, there'll be occasionally you'll get pop-up windows stating that there's a hashtag, a pound sign. It's stating that, hey, there's a pound sign here. What do you want to do with it? And those have to do with outdated ICD-9 codes. Okay, so it's prompting the provider, whoever the provider would be, to address this code. In this case, I inactivated it. Okay, because I believe you won't be able to sign notes or add other additional diagnoses if this hasn't been addressed, this hashtag over here. So I just did that today, actually. I just inactivated it today because there was that notification showing up. Okay, you could again, very Windows-oriented type of layout here. You could right-click. You could change different settings for these problem lists. You could inactivate, annotate, remove. You could also double-click, or as you noticed there as well, you could right-click and view details. Same window. Okay, a lot of redundancy involved, but otherwise, that's all I'll have to say about the problem list. And this is the same problem list that shows up in the cover sheet, by the way. Okay, right here. Okay, in the cover sheet, you won't be able to document any problem list. You'll have to do that in the problems tab, but just an FYI. Okay, so now I'll move on to the meds tab at this point. Again, this is more for an FYI. As a nurse, when I was a nurse at the bedside, I really didn't look at this that much as what I need to currently give to my patients at that moment. Okay, but for the provider, this is where they would review a lot of their meds, a lot of the patient's med that need to be refilled or reviewed or discontinued as well. Okay, so for the this is more for the provider's perspective. You could go ahead and you could enter new medications from at this point. Okay, you'll notice there are 3 categories of medications: outpatient, non-VA meds, and inpatient. And Rhonda spoke about that briefly. And again, when the patient is an inpatient, we do have an inpatient as a test patient, but I'll go ahead and do that you'll notice that the sections of that medications tab switch out. Okay, and hopefully there are some inpatient meds for this patient. So this is how it's going to look like. Okay. Okay. So from this, you notice that the inpatient medications are up on top now. Those are the primary medications. Outpatient meds are at the bottom. Non-VA meds remain in the middle here. Okay. From the provider's perspective, whether or not the inpatient or the outpatient meds are on top, they can order meds from this window, although we don't recommend it. Primarily because if you'll notice some of these meds that they'll put in, let's put a new medication for, as a nurse, you won't be able to do this, by the way, just an FYI, okay? You could right click, you can enter a new medication, you could refill or renew, and even discontinue meds from this view as well, okay? And you'll notice later on as well that this same medications will be in the orders tab as well, will be displayed there. But this is more focused on medications, okay? So other than that, I'll move on to the next topic. Okay, I'm going to the next to the previous patient as well. Okay. All right. So now the orders tab. Okay, so this just a brief overview of how the orders tab are set up. On the upper left is the view orders. There's usually one line item there. It defaults to the active orders. There are certain, you could customize your orders as well to see orders that were entered in the past week or even in the past several months. Okay, but in the meantime, I believe this only displays the past 72 hours or so of active orders and pending orders as well. Okay. So you'll notice here the main items I want to highlight as well is that under the service column, those are the different categories of orders that are in our FHCC orders tab. Life-sustaining treatment is a VA directive, VA initiative. Basically, it outlines the different kinds of life-sustaining treatments a veteran would like for their end-of-life care or life-sustaining treatment care. Okay, that is across all VAs. The life-sustaining treatment is at the top of every orders tab. Okay, and now as we scroll down, you'll notice there are other. So there's a lot of The RTC is an older return to clinic orders. We no longer use that return to clinic orders. That specific one that were locally created here. That one has the ones that we use now are called it's under the category of clinical scheduling at the bottom, near the bottom of this orders tab. Okay, ADT is admission, discharge, transfer. This is where the MSAs would look to see what kind of patient movement they'll have to do in VISTA for this patient. You'll see the vital signs, nursing, diet, outpatient meds. There'll be inpatient meds as well if we had one for this patient. Clinic medications are medications administered at the clinic, which is distinct from outpatient medications as well. Okay, you'll notice there's lab, imaging, consults, procedures. Get Well Network is a category where a provider or even a nurse can put in orders for video education. We do have a Get Well Network at our facility. So when you enter a Get Well Network order, you sign it off on it, and the patient in the patient's room will be queued the actual video that they'll be prompted every so often to view. Okay, like hand washing. There's some that are specific for their diagnoses. Okay, and there's new ones here too as well. A future self alert. This is more for the providers and nurses as well, if you want to remind yourself that this patient needs some item followed up in the future. Okay, but this is relatively new, so I won't discuss that too much. I'm not really familiar with the detail. Okay, but you'll notice here the different. Keep in mind of the different columns in this orders tab. Okay, service, the actual text of the order, stop time, the provider. Okay, nurse, this is when you verify orders during shift report or when there's a new order during your shift. Your initial will show up here, and I'll show you how to go about verifying those orders. As well, clerks as well would verify orders also. Okay, the different statuses are active, pending, discontinued, canceled. Okay, and the location. This is important in that, especially for patients moving from one ward to another. At least, when I was at the bedside nurse, I would pay attention to orders that were ordered at the ward that I'm working at. Okay, so if there's any medications that shows up in the barcode in BCMA, for example, that were intended for a different location, I would question that medication. Right, I would either call the provider to either, do you want us to continue it again? You might want to order it for our location here, or discontinue it. Okay, so just keep that in mind, because we've had it set up so that medications when patients move between wards are set up to discontinue, where providers are then forced to order new medications, but sometimes it can slip through the cracks as well. Okay, so in order to actually write a medication, you will click on your order menu. I put one in for you as an example. Okay. So one distinction that I want to make between, before I move on, between inpatient and outpatient is that when Rhonda was talking about the cover sheet in the beginning, you'll notice that up here, this is the visit encounter data. You'll notice that if a patient is outpatient, that you as a provider will need to manually select an appointment associated with your notes, with your orders, consults, and all that. When a patient is an inpatient, okay, all the orders and notes default to the inpatient stay. Okay, so if, for example, if a provider with a specialty consult, okay, ophthalmology were to come in and put a note for this patient, they would need to have had an appointment set up already before they see the patient. At least that's the ideal situation. So in other words, when I as a specialist would come in and see the patient when the patient is in inpatient status, I would click that provider location button, and I would select the clinic appointment. Okay, so that any notes, any orders I put in from here on out would be associated with that appointment. Okay, this is more for provider's perspective as well. We'll go ahead and click add an order for this patient. I think this is what I assigned you. Okay. So in your case, there are several kind of orders that you could put in. There's imaging, labs, MRSA. There's also a word processing order. Okay. To actually put in an order, let's go ahead and put in a lab. Okay. Okay. And if the patient inpatient, it's all going to be usually, depending on which ward. I'm used to doing a ward collect for these kinds of labs. Okay. For inpatient, for example. So I'm going to go ahead and click on one of these guys and click on Google. Okay, and again, these are set up as quick orders, meaning that a lot of the items, all the fields are pre-filled already. That's hence quick order. Otherwise, if there was just a regular lab order dialog, this one here is called an order dialog. A lot of these items will be blank, and so as a provider, it'll be your responsibility to fill in all the different fields. But these are quick orders, and so a lot of items are already pre-filled. Okay, accept. Okay, so since I'm set up as a provider, what I'm going to do is I'm going to right-click, and I will sign immediately. Okay, in your case as a nurse, what you'll need to do, is click on Action, and it won't show up on my screen here, but on your screen there should be release without MD signature. Okay, what that does is it allows nurses to release orders, without MD signature. Basically, the attending physician will be attached to these orders. Okay, so go ahead and sign that one. Once you sign the order, it'll go to the section where it's at. Okay, so I'm going to do that with this one as well. Okay, so here's that lab now. And it's going to be in pending status until lab acts upon it. Okay, so you'll notice here that I've only got several sections here, but I'm going to go ahead. If you want to go ahead and add other orders, other types of orders as well, I think I want to just highlight when you have multiple orders on this orders tab, that you could highlight all of them and sign them all at the same time, or release them without MD signature all at the same time. These are the reason they're called text orders is that some orders, such as lab, go directly to what's called a lab package. So it has its own programming in Vista. So that lab package is interfaced with different instruments so that it is ready to receive data. Okay, think of it that way. Pharmacy, the drug file as well. Pharmacy uses that. There's one for radiology as well. Okay, again, instruments interfaced with Vista to receive, and Vista is ready to receive information. These text orders don't go anywhere. Okay, they're not connected to any package. All it does is we could force them to display in a certain category, like nursing, admission, discharge, transfer. Those are the categories that uses a text order. Self-alerts as well. Okay, and you'll notice here you could free text on these things as well. Okay, and when you accept them, they will eventually show up in a category that doesn't have its own package. Okay, so diet has its own package, medications, labs, consults, and radiology all have their own packages. Okay, and so I'm going to go ahead and sign off on these. Okay, you could highlight all of them at once. You could click, keep your left click button depressed and highlight down, or sometimes if you have a long list of items, you only want to select one or two items, you could do press the control key and then highlight the next one you want to. Okay, and I mean, it's only applicable if you have a long list. If it's such a short list, like 3 items, it won't really matter. Okay, so on my end, I'm going to right click and sign it. On your end, it's going to be action release without MD signature. Okay, and if you have any unsigned orders at this time, and if you try to open up another patient's patient's chart, you'll be forced to address those unsigned orders or unsigned notes as well. Okay, so, and I did that just for review. So now once you've signed off on an order and you decide, hey, I need to discontinue this order, it's wrong, it's obsolete, there's other orders that I need to fix that need to be removed from the chart so people don't get confused, you could right click on that order and you could discontinue. Okay, and you'll have to select a reason for discontinuing the order. In this case, I'll put obsolete. Okay, and right now it will be unreleased because I signed the order initially. I need to sign that I'm discontinuing the order. Okay, so I'm going to highlight on this one and sign it as well. So this is verifying that I'm agreeing to discontinue this order because I've signed it ahead before as well. Okay. Again, this is defaulted to, if you're working in inpatient, typically this view here should be sufficient. If for some reason you go to a different, if you're asked like, hey, what happened to this medication that was entered 2, 3, 4 days ago? Okay, you can customize your view from the orders tab as well. Okay, in order to do that, you go ahead and click on view and then custom order view. Okay, and you'll have the ability to see even orders that were discontinued as well. To me, when I'm looking for if I know the date range or if I know when the order was placed in the past, I would just click on this upside down caret, I guess. Okay, so that all is selected as well as this one as well. And then I will limit it to a certain date range where the orders were entered. And I'll just limit it to today, okay? There's a time field as well, but you don't need to put that in. Okay. So when you click on OK, you'll have the orders that were placed today, or at least placed today or active. Okay. Now and You have the option to save this view as well. I don't recommend it. I think this is more for if you're reviewing the orders in the past. Okay. Otherwise, I would click on File and Refresh. You certainly don't want to make that your default view. Okay. Just know that there's a capability to do that. Okay. So again, in your case, if you're reviewing your medications or orders, I would, especially during shift handoff, I think some wards as well, what they do is they do a review of the chart as well. So it signs off on the right-hand side of this chart. There's going to be an initial, okay, that shows up on there as well. Okay. So. All right, so we're going to the Notes tab now. Okay, so mine is customized to display notes that start with the word nursing. Okay, yours most likely won't be. Okay, so I could show you how to do that after I go through this. Okay, so keep in mind, just a brief overview. This displays, the default is the last 100 signed notes, and you'll notice there's 103. Some patients will have thousands, okay? So definitely you don't want to see every note, okay? You want to limit it to a certain date range or a certain number of notes, okay? So leave it at 100 usually, okay? On the right-hand side, in your case, I think you'll have, when you highlight on a note title, it'll show the body of the note on the right-hand side. On the bottom of it are your encounter information. These are information that deals with the diagnosis, the procedures that were done for this patient. Okay, some notes have it, some notes don't. Okay, so not all notes are going to have this one. Okay, so on the bottom left, you'll see there's a templates, encounter, and new note. For the most part, you'll be starting new notes. Okay, so when you click on new note, in your case, we'll set you up as well. I'll set you up with this as well. In my case, I have the top 5 or 6 notes that I usually use. Okay. In your case, I think it'll look more like this, where it's alphabetical. It's everything. But to actually select a note title, you could type in the title of the note, or you could have it listed here. So I would type in nursing note. Okay. You notice it'll default to a date of now, and it'll default you as the author. Okay, click on OK. Some of our notes have templates associated with them. This particular title does not. Okay, so when people refer to this as a blank note title, this is what they mean. There's no templates. Okay, so you just type in anything you'd like on here. Okay, right click and then sign note now. Okay, you'll be prompted to enter your electronic signature code. And there it is. There's your electronic signature. So suppose that you're trying to enter a note. The template is extremely long, and I know admission templates are. Just FYI. Let's say you have to go and see your patient. You're in the middle of writing a note. What do? Okay. So in your case, what you could do is you can leave it in an unsigned status. Okay. You could go. Let's see. Save without signature here. Okay. And I believe you have that same option if you right click. Okay, save without signature. What that does, it saves in unsigned status. Only you can see it, nobody else can see it. Okay, so in order to go back and addend that note or edit that note, we'll right click and edit progress note. And it's the same menu item as well if you do action edit progress note. Okay, and then you'll notice that the background becomes white. It's editable at this time. You could add another line item here, and you can go ahead, right click and sign note now. Okay. Okay. Now there are instances where you fill out a note and you want to notify providers or other nurses. Perhaps there's a program involved with a patient. Then you want other users to be notified that a note has been entered. This particular title has been entered for this note. You could identify them as an additional signer. What that does is just a communication tool. They can sign off on it. It's just stating that they've received a notification. It has no legal consequences for them. Okay, you'll notice on the note here that there's an expected cosigner item. That's a separate category altogether. That's more for resident physicians or even student nurses. Basically, any notes that resident physicians or student nurses or staff that is in training, any notes that they entered need to be reviewed by someone who actually has a license or credential. Okay, that's a different category altogether. I won't talk about that at this point. Okay, but in order to add an additional signer, you'll go ahead to Action and identify additional signers here. I'm going to put one of my coworkers, if I could spell it. Okay, and in actuality, you could add as many people as you want on this note as well. Okay, and before I say OK, actually I'll go ahead and say OK. Now, if I decide, okay, you know what, Britt shouldn't actually be receiving this note. I changed my mind. I think you may be able to do this as well. So, click on Action and identify additional signer. Highlight the person's name and remove. Okay. So in this case, I'll leave it on for now, just for training's sake. Okay. So this is what it's going to look like. Now, Britt, when she opens this patient's chart, or whenever she opens CPRS, she will get a notification here stating that there's a additional signer notification. And so when she clicks on it, it'll go to that note and open up that note. Okay? So that she could review it, sign it, and she's done. Okay, so now I want to focus on the different types of templates that we have as well. Okay, so this is that's a blank note, and this is one of the simpler templates that we have as well. This is called, well, I think it's better described when you see the actual note itself. Okay, it's a very simple note. It's a matter of check boxes, adding items to it. In this case, I'm just gonna, there's some check boxes that this note, if you click on preview, won't have any item until I start entering data into it. Okay. In this case, I'm just going to select this first part here. It says tour, and when you see an asterisk, that means it's forced entry, required entry. You have to select an item. Okay, and I'm going to click on that. And here at this point, I'm just going to show preview of how this note will look like. I won't go through the entire note itself. Okay. All right, so that's how it's going to look like on your progress note when you sign it. Okay. Now, this type of note, you know, depending on mental health ward, what kind of notes they want to fill out. Usually, the format of the note titles is the service and then the description of the note. Okay. So in your case, it's going to be mental health nursing, or it could be mental health, you know, H&P for the providers. Okay, but that's typically the format of the note titles. There are some note titles also that are nationally based, and so everybody has to use that note title anyway, like community care, for example. Okay, so in this case, you'll click on OK for now. And by the way, I'm not condoning to skip a lot of these items. I just want to show that the different items that are available. Okay, and this type of template is. Yeah, you could skip a lot of items, in fact, but I will defer to your department on how to handle these types of notes. But I don't condone skipping it. I'm skipping it for now just to make it easier, okay, for review. So you could click on OK, right click, and sign the note now. Okay. Now, there's also a second type of template. It's called the Reminder Dialogue template. This one is a little more flexible on our end, but it's also, I guess, sometimes some staff will have issues with loading these templates occasionally. Okay, occasionally, just letting you know. Okay, so this is how it's going to look like. You'll notice that there's a yellow field at the bottom here, or two yellow fields, in fact. The first yellow field that you'll see here, this is where the actual note will be previewed as you're typing it, okay, as you're entering data. Okay, in this case, I'm just going to select this. You'll notice that this is how the note will look like. Okay, until I add other items, it'll start appearing here. So it's a good preview for the CPRS user. Okay, this encounter information here, has to do with identifying different data types, data elements. It's more for reporting purposes. We could also enter different diagnoses and things like that in this section, put in different quick orders as well. Okay, but it's not as important as for you in your everyday use of the template. What's more important is the fact that some of these items are required. Okay, if I try to finish it, you'll get an item like this. Are you the primary provider for this encounter? Always select yes, unless it's always select yes. This, when it says primary provider, it's the generic provider. It's not a provider MD. Just an FYI. Okay, unless there's definitely another provider MD that needs to be associated with it, you are the provider at that encounter. Okay. So some of these items also will have forced entries as well, and sometimes there'll be windows stating that this group needs to be, there's a required field for this group, okay? But in this case, I'm just going to finish this. I'm going to click yes, and then you could sign off on this note, okay? One other item, I'm going to delete this one. I think mental health, I believe you may have to do a lot of clinical reminders as well. Again, I'll defer to your manager for that one. In order to, Rhonda alluded to the clinical reminders here with the yellow, with a clock here. Okay, the P represents items that need to be filled out by providers, provider MDs. Okay, N is for nurses. So think of it as from this line down here. It's typically nurses are responsible for it. This line and above are providers, and somewhere in the middle, it's usually nurses, unfortunately, but it's there, right? Okay, so you'll notice main thing here that these are the clinical reminders that are due for this particular patient. Okay, and again, as Rhonda alluded to, it depends on the patient situation. Their age, their gender, their medical history. Okay. Now, in order for you to actually document to respond to these types of clinical reminders, you'll have to do it in the Notes tab. Okay. So what you'll do is click on a new note, and again, I'm just going to use the generic nursing note. Your service may be using a different title. Okay. I'm just going to use it because it's blank, and you'll notice here now that there's a reminders button that show up. Okay. It's not usually there until you open up a note. Okay, you click on that, and you'll notice all the reminders that are due for this patient. Okay, and I'll just select one of these items for now. Hopefully that's not the more. Okay, so there's different dialogues here, and I'll just say no at this point. Okay, and then you'll notice here this is where the different encounter and data elements are tracked, which reports can be run. Okay, and I'm going to click on, never click back or next, only click either cancel or finish at this point. Okay, if you're unsure about a certain reminder, I would recommend click cancel, delete the note, start over. Okay, don't click next and don't click back for sure. Okay, I'm going to click yes on this one, and I'm going to sign off on it. Okay. Any questions so far? Okay. So now what happens if you inadvertently fill out a note? Oh, it's the wrong patient. Oops. I've got to correct it. I've got to get it deleted or retracted. How you go about doing it is you first of all add an addendum to it. Okay. And click on action and make addendum. Okay. Click on action, make addendum. And then just type in the reason for retracting. Usually note entered in error is sufficient. Okay, and sign that addendum. Okay, you'll notice this is how it's set up. Your original note has, if you highlight it, the original note will be on top, and if you scroll down to the body of that note, you'll notice that the addendum is there at the bottom. Okay. Now in this case, highlight that original note, click on Tools, and then note entered in error. Okay, and this is for retracting the note. There'll be another window that shows up, and you'll be prompted to enter your access code, verify code. Okay, and there are 5 categories of items. Typically, the first one is what you will use. Okay, and there's other reasons for using that tool, the note entered in error, to relink a visit if you're in your outpatient, or if there's a consult that needs to be linked, or some item in a clinical reminder. Okay, those are the 4 main categories. What we also see is that some staff may use other. It's not as helpful to us to act on because it doesn't have a note title. It doesn't have the reason, what they want us to do. Sometimes they want us to retract, but they select other, but we don't know that because it doesn't say retract note. Okay, it's only until we, sometimes there's a way to look to see what note the person authored, but it's preferable to use one of these 4 categories. Okay, so in this case, we'll do retract document, and then it's going to say what's the note title. You could either type it in here, but for now, you can actually do a copy and paste. Okay, in the meantime. Okay, and the date time of note, this will be helpful as well. Copy and paste the date and time. And the addendum completed, just click yes. When you click OK, it's going to give you a preview of what the note is going to show, what the message is going to show, and our team will receive that message, and we'll go ahead and retract that note. Okay, any questions so far? Okay, and so before I move on to the next one, I guess we'll just customize your notes view as well. Okay, so we'll go ahead and go to Tools, Options. Okay, click on Notes and Document Titles, the second button. Okay, the document class, leave it as Progress Notes. Now the document titles, do you know which titles you use right now? Not yet. Okay, so I would suggest mental health, probably nursing, if there's one. Yeah, that would be helpful. Yeah. Yeah, so once you have the list of note titles, you could select it here, click on Add, and then click on OK. Okay, and you could do that for a list of your note titles. Another item we could probably set up for you as well is your the default. So when you open, we'll leave yours open here. I'll just show. When I open a patient's chart, when I try to open CPRS, in your case, since you're new to CPRS, you won't have a default list of patients. You're probably, you'll have something that looks like this. It's just an alphabetical thing. You don't know what patients are on your ward. Okay, but in order to customize it to your ward, let's go ahead to Tools and Options, as you already have there. We'll go to List Teams. So there's a 2-step items here. Click on Source Combinations first. Okay. Now select the ward radio button, and then you could select the ward or wards that you'll be working at.
I can select.
Yeah, you could select multiple wards. Okay. And once you're ready, let me know. Yeah, so is it 134 or something?
Well, I'm in 131 4C and 4A, but there's like a 4A, 4AD, 4A.
Yeah, you definitely want to have all of those.
All of those.
Yeah. Yes. So it's going to depend on the patient, whether they're veteran or active. Yeah, you definitely want all of those.
Okay, got it.
Okay. Okay. So once you click OK, or once you've added it to the combinations on the right-hand side, click OK. And then click on Patient Selection Defaults button. And then what you're going to do is select the combination radio button, and typically alphabetical should be sufficient. Okay. If you're working in the outpatient clinic, sometimes they want it as appointment date. So they want to see the patient chronologically based on appointment. But in your case, alphabetical should be sufficient. Okay, and just make sure that everything is defaulted to today. Okay, and click OK here, and click OK here. Then when you open that, click on this one. I just want to show you that your default list should already be there. Okay, and it should default to combination. Not quite.
Something, it won't let me go in because I have some changes somewhere.
So that's consults time. Do you want to talk about? So items that I forgot to talk about to mention are the addendums and also the shared templates. Okay, to make an addendum, let's say additional items that you want to add to your note. I've already alluded to it when you're putting a note entered in error. Okay, but just to formalize it, highlight the note title that you want to add an addendum to. Click on Action and make an addendum. Okay, it's pretty straightforward. And then right-click and sign. And another item as well is that when you're entering a new note, there's also a series of shared templates that the different departments have created for their wards or for their services. So you don't need to do this right now. I would suggest discuss this with your manager or your coworkers as well. Okay, I'll select a blank note for now, and then there's a templates button here, and these are all the shared templates that's been created at our facility. Okay, there's one for nursing, there's one for different services. I'm going to see if there's one for mental health specifically. Okay, so they may be using this one as well, mental health admission clearance. I'm not sure. Okay, but you'll notice there's some MH note titles, template titles. Okay, these are actually just templates. So what you're doing, what me as a CPRS user is doing is I'm just selecting a template to add to a note title. Okay, so that's, if I click on this one, you'll notice this is how the display looks like. Okay, so I'm not going to sign this. I just want to point that out, that there are templates that's been created, and I would again suggest to discuss with your coworkers if there's any shared templates that are applicable to your ward. Okay, so I'm going to delete this one. Okay, so moving on to the different we're going to the surgery tab now. This one is read only. This is more applicable if a patient has had surgery in the past. You'll see the different cases that's been performed for the patient. It'll be displayed here. Yeah. So this is the Okay, for the surgery tab, again, these are only read-only items, but you can glean and see what kind of information is in the surgery tab here. This is a test patient. You'll notice the different cases have their own line items, and if you expand that folder, there'll be 3 reports in each one. One is an operation report that the surgeon will place in there, will dictate the anesthesia report by anesthesia service, as well as the nurse intra-op report. Okay, and again, there's nothing for bedside nurse to perform here other than to review what the surgery was. Say if a patient had a post-op, they go to med-surg. It would be maybe helpful to see how much fluids the patient had or what kind of medications the patient was on. Okay, and there's not much else to talk about with the surgery tab other than reviewing data for the surgery. Okay, the discharge summary will only be applicable for patients who have an inpatient status, and this is used it is used by provider MDs or resident physicians as well. Okay, they would go ahead and click a new summary. They'll be prompted to select which admission to attach this discharge summary to, and I'm going to go to the test patient that's been admitted, just so you could see the different displays for that. Okay. Okay. So when I click on New Summary, it will prompt me. I will be defaulted as the author. It'll show the different discharge summary titles, and don't be caught off guard by this. It's all pointing to the same discharge summary. It just happens to be the different shortcuts to it: DCS, discharge summary spelled out, and summary. Okay, don't get caught off guard. These are all the same discharge summary, and we only have one title, and I will be prompted to select which admission to associate it with. Okay, I'm going to put Dr. Lee for this one as an attending physician. Okay, and I'm going to go ahead and put in a discharge summary. Okay, you'll notice it's a blank template. We are working on the templates for this one. There will be a template associated with it. Okay, so otherwise, the resident physician can click on templates, shared templates, and there's one already that's been created prior, and it has all the different headings and the different pertinent items that need to be entered. Once that's done, go ahead and sign that note. Okay? Right click, sign discharge summary now. Okay. So I'll just skip that for now and delete it. Okay? Any questions about that? Okay. And all the different, if the patient has had multiple admissions in the past, it'll all display here as well. There are also, if for some reason a provider or anyone asks for a consent form, paper consent form, tell them they can't use it. They have to use imedconsent. Okay, paper form should only be used as a contingency. Okay, just an FYI for you, you don't typically have to use imedconsent. So I'm just talking about this for the provider's sake. Okay, so in order to access imedconsent, first off, the provider, the CPRS user, has to make sure that this context manager is turned on. It's one blue figure and a chain link that's been connected. Okay, it should be in that position. If it's not, imedconsent won't launch at all. Okay, no matter what they try. Okay, so once, assuming that this is present, the provider will then click on Tools, imedconsent. Okay, put in here access verify code.
Hang on. Let me enter this.
So in this case, a provider can look for a consent form based on body system, or they could also do a word search. Okay. There's different kinds of items that they could select. I guess I'm just going to select this one for now, just for a test, aortic stenosis. Double click on it. Okay, so I selected aortic stenosis, double clicked on it, and in this case, I'll have to look at this particular imedconsent. It really shouldn't be displaying this part here. Okay, but I'm just going to select the default non-consent. Click OK. Okay. Okay, this is an educational type of imedconsent. It's not a consent form. Okay, so once you save it to the chart, it'll just save a copy of the form stating that the patient was educated on this particular topic. Okay, so I'm going to close out this document. I'm going to select an actual consent form. I'll select a blood product here.
Document.
Oh, yeah, I just did this.
Oh,
great.
Okay, I'm going to select blood transfusion here. Okay. Select a basic blood transfusion consent form. On the right lower hand side, there's a begin consent button. Click on that. And this will show different displays of prompts for the consent form. Some are required, some are not. Okay. In this case, does patient have a decision-making capacity? Yes or no. Does the patient have a DNR order? Okay. Click on next. I've selected yes and next on this one. And this is about the surrogate. Okay. And then there are other items that you could type in here as well. I'll leave it alone for now. And finally, I'll put in myself. Okay. And if there's a supervising practitioner, you'll enter that as well. And I'll click on finish. Okay. These are different reminders here about imedconsent. I won't go through that. At this point, you can hold for signature, or if the patient is ready to sign it, you could click on the sign button at this point. And typically, there will be a signature pad available at the bedside. Otherwise, you could also use the mouse. Okay. So here, this is legal to. We can use the mouse to sign imedconsent, by the way. And this is for the patient. Okay. Now, once we click Save to Chart, an image of this consent form will appear in CPRS.